Breaking news.
I'm Hank with Brattleboro News and PlanetHank.com. The General Assistance Emergency Housing Program, more commonly referred to as the Hotel Voucher Program, has existed in Vermont for a very long time. Over the last few years, it has undergone a series of changes, both in what qualifies a household, as well as how long said households would be housed in rooms of participating hotels and motels. Big changes were made during the COVID-19 pandemic that increased the number of rooms available, and our state's hotels saw an influx of residents while our country was urged to shelter in place. This money to help our country through COVID was not going to last forever, though, and now we are seeing the consequences that come from dried up funds. Vermont now faces another serious issue that is affecting our communities in regards to housing, or rather lack thereof, as changes are made to the law placing an 1,100 room cap in place and limiting the amount of days covered by the program. As of June 1st, each household was allotted 80 nights of vouchers to be used within a 365-day period, leaving people with nowhere to stay between September 15th and December.
There was a program that started June 1st, the hotel program. You have 80 days and we used up our 80 days. We have children, so we had to use up all of them, and now we were kicked out because we have used them.
So we have misplaced our children because of this program ending, and now we have to wait 2 to 3 months until the weather strikes below zero, and then we can start with new vouchers and getting housed again. People are out there losing their kids, losing their lives over this. It's not fair.
The program can be very beneficial for a family or individual that is experiencing homelessness that needs a temporary place while they get back on their feet. There are a number of things that could qualify a family or individual, but these vouchers are first given to people 65 years or older, children 19 years old or younger, people experiencing life-threatening conditions due to violence, or somebody who is pregnant, and so on. Once they reach 90% capacity, the state will follow a new administrative procedure to help distribute the remaining rooms to the most vulnerable households, according to the Economic Services site. Other situations could also qualify for emergency assistance, such as losing one's home to a natural disaster, loss of housing through no fault of your own, an unexpected loss of employment, or an unexpected health issue. With estimates of well over 3,000 households experiencing homelessness, everyone seems to be scrambling, but unfortunately, no one seems to have any viable solutions. Governor Phil Scott has made statements that even at the state level, we just do not have the money. Vermont is a shelter-first state, which means that if there is space available in shelters, then that is the first option. But if there is not, then a hotel voucher could be a temporary solution. Keyword here is temporary. It is not feasible to house families and individuals in state-funded hotel rooms long-term. We're also seeing people from other states coming here to obtain state-funded shelter and other services, only growing the number of people who need help.
I'm from Bridgeport, Connecticut. My 80 days up, and I never knew I was on any 80 days. There's people, I've been on it for 4 or almost 5 months. That's it. There's people on it 4 and 5 years. And how did I get 60, I'll be 70 next month, and it's like, I've got a broken spine, cracked spine. I got stents in my heart. My doctor says me sleeping on the ground in a tent, that's death sentence.
The hotels have been a hotbed for crime and drug usage, which has spurred rigorous debates during town meetings and amongst Brattleboro residents, with the Quality Inn being the #1 most responded to hotel in town with 732 incidents, according to the Brattleboro Police Department's data project conducted by Dr. Robin Joy from the Crime Research Group.
Vermont needs to turn around and change the way their programs are running right now. It should be mandatory that people go into a drug treatment program or they don't get the help, because all they're doing is living off from the state. I'm sorry, but I just have to be honest, and I've seen too much of it.
As of September 15th, a number of people have had to leave hotels that were essentially their homes after reaching the maximum allotment of 80 days in a 365-day period. We've seen a lot more people on the streets. I was able to get comments from a few people affected by the 80-day limit.
We used up our 80 days already. We have a child, and on next Saturday we are out. We probably will have to go in a tent, and then we're afraid that DCF is gonna, give us a problem and take our son because we have no way to bathe him, feed him, have the proper shelter. I think this whole situation of 80 days, that's it, till the winter is ridiculous.
So I've used up almost all of my 80 days and I have nowhere to go if I can't save up the money for an apartment. I am just on the street with my two kids. They're 9 and 11. They're going to have to go to school with being on the street. How am I supposed to do that? How are they going to be able to do that? My car is about to crap the boat. Like, it needs at least $1,000, maybe even $2,000 worth of work. If I can't get that taken care of, I don't even have a place for us to stay, even if I don't have anything here. So we're not going to be able to go anywhere. We won't even have the car. It's going to be cold, and we're just going to be on the street with nothing.
Come December, they will be eligible to enroll in the program again, as there are no caps during the winter months. However, it will become effective again once the warm weather returns, giving our state a very short window to work out some form of solution. I'm Hank with Brattleboro News and PlanetHank.com, sponsored by Brattleboro Ford.